Good day, everyone. So we are the Group 6, and we're going to present to you our report for today, which is the substance abuse and withdrawal, violence, abuse, and neglect, and also psychiatric emergencies, together with Miss Angelica Guevara, Miss Udine, Miss Honyo, at saka si Mr. Chosen. So let's start with what is addiction and substance abuse? So this can actually appear to be the casual in a certain setting. When we say addiction, on the other hand, it is defined by using substances that have the impact on the brain's reward center that's so strong, or it alters brain functionality. So moving on, yes.
Friend, anong yes? Wait lang. Nagna-next ba?
Wala.
As in? Yan.
So, ayan.
Nasa na?
When we say addiction, again, it is a psychological and physiological dependence on alcohol or other drugs or of abuse that affects the central nervous system in such a way that withdrawal symptoms are experienced when the substance is discontinued. So here are the common use psychotropic substance. So basically, we have here the alcohol that contains ethanol and toxic psychoactive substance with dependence-producing properties. So ito yung pinaka-common na ginagawa ng karamihan, mostly yung mga teenagers na as of now, umiinom or isinasagawa. Okay, when we say tobacco, this smoke contains many chemicals that are harmful for both smokers and of course for those non-smokers. And when we say cannabis, this can actually lead to acute psychosis in many individuals and can produce short-term exacerbations, disease such as yung schizophrenia. However, when we say pills, this can actually cause when a person has accumulated too much of a drug in his or her bloodstream. And when we say sedatives or high hypnotics, for example, given yung barbaritos. And of course, we also have here the cocaine. It is an illegal stimulant drug that affects our central nervous system. So we have here the etiology of pagiging addict or for such using substance abuse. So basically, we have here this genetic vulnerability, which is the family history of substance use disorder, which is meaning that the member of the family can actually adopt by using such substances that later on patuloy na ginagamit ng other member of the family. And when we say biochemical factors, ito yung role of dopamine and norepinephrine that have been implicated in cocaine, the ethanol, or the opioid dependence. And also we have here the abnormalities in alcohol, dehydrogenase, or in the neurotransmitter mechanisms or thought to play in alcohol dependence. So we have here the psychological factors when it comes to addiction and of course when using such substance drugs. So basically, maaapektuhan dito yung tinatawag nating general rebelliousness. And of course, yung sense of inferiority, you have this poor impulse control, and pagkakaroon ng mababang self-esteem, and you have this inability to cope up with the pressure of living in society, such as having poor stress management skills, at saka yung loneliness, unmet needs, desire to escape from reality, and of course, desire to experiment a sense of adventure, pleasure seeking, and of course, sexual immaturity. So, what do we mean by psychiatric disorder? It has something to do with a substance use disorder or more common in depression, anxiety disorder, or yung tinatawag nating social phobia personality disorder, especially yung tinatawag nating social personality. And of course, we have here the occasionally inorganic brain disorder and schizophrenia that a lot of people or a lot of people out there are actually experiencing this kind of disorder. Okay? So moving on, we have this epidemiology. So 2% incidence of alcohol dependence in India. However, 20 to 30% subjects aged above 15 years or current users of alcohol, and of course, nearly 10% of them are regular or excessive users. On the other hand, 15 to 30% patients are developing alcohol-related problems and seeking admission in psychiatric hospitals. So may tinatawag tayong types of drinkers. Ito ba yung tinatawag nating maoy or ito ba yung mga moderate users or drinkers? Okay, when we say moderate drinkers, sila yung mga may mga ano lang, kumbaga mini-maintain lang or nasa point lang sila ng sige inom lang tayo. Kasi it does not actually cause much problems or physically or it's either mentally. However, when we say problem drinkers, ito yung tinatawag natin ang daming problema kaya tara siya puno. Guys, ganon. So it actually cause impaired health, family, and of course, society. So, ang daming factors kung bakit nangyayari yung mga bagay na yun. Ito nga yung tinatawag nating factors, which is having a chaotic home environment kung ikaw ay nasa risk factor. You have this ineffective parenting. And of course, you have this low academic aspirations, poor social coping skills, and yung pagkakaroon ng parental substance abuse or yung tinatawag nating mental illness. However, on the other hand, kung meron kang tinatawag na protective factor, whether in your family or in a particular environment, we have this actually strong family bonds. Yung tinatawag nating parental engagement in child's life, excuse me, and of course, you have this academic success. At saka yung tinatawag din natin conventional norms about drugs and alcohol. So those are the factors. So we have here the process of alcoholism. What do we mean by experimental stage? So basically, drinkers may new to different forms of alcohol, di ba? That likely to taste or to test their limits, actually. Nag-experiment sila. However, once na-come up na nila yung particular experimentation na yon, may tinatawag na tayong recreational stage. Ito yung, since you are curious about a particular substance, then the taste was actually good, then uulitin mo siya. Uulit at uulitin mo siya. To the point na nagkakaroon na tayo ng relaxation stage kasi nga hindi mo na namamalayan that it actually suits you. Nagiging dependent ka na dito. To the point that you have this compulsion stage that your behavior are prominent in addiction. Meaning to say, ginagawa mo na siya na parang normal na lang. Whenever and whenever they desire. So that is actually the basic process of alcoholism. However, may tinatawag tayong, pa-next nga, may tinatawag tayong stages of alcoholism. Since nabanggit natin kanina that you are now in this compulsive stage, which is isinasagawa mo na siya ng paulit-ulit kasi nga your behavior are prominent in such addiction. Meaning that you are in this progressive phase. Gumagawa ka na ng mga bagay na makarumalduman o hindi naman kanais-nais that tend to a crucial phase. Or bababa ka na, tinatawag natin crucial phase na totally addict ka na, dependent ka na sa particular nicotine or such drugs or alcohol, kaya andito ka na sa crucial phase. Ang dami mo ng maling ginagawa, sabihin pa natin. To the point na kinakailangan mo nang i-rehabilitate. Rehabilitation phase. Then later on, road for recovery, kung makaka-recover ka man. It actually depende sa tao. So we have here kung paano ba yung alcohol umaatake sa utak natin. So first, yung alcohol basically, it affects yung forebrain at saka and the assaults motor coordination and decision making. Doon na nagsistart yon. Then later on, yung alcohol knocks out the midbrain and you lose control over emotions and increase chances of blackout. Ito na yung tinatawag nating crucial phase, which is wala ka ng sinasanto kasi nga dependent ka na dito, addict ka na, lahat ng mga negative actions or factors is ginagawa mo na. Then finally, that the alcohol batters in the brainstem as it affects our heart rate, your body temperature, the appetite, and the consciousness, and of course, the dangerous and potentially fatal condition. Andun ka na sa part na yon. So we have here the psychiatric disorder due to alcohol dependence, which is yung tinatawag nating acute intoxication. We have this withdrawal syndrome, and of course, alcohol-induced amnestic disorder, at saka yung alcohol-induced psychiatric disorder. Okay, let's move on. What do we mean by this delirium tremens? Ito ba yung, of course, nagdi-delirium na tayo. It occurs is actually within 2 to 4 days of complete or significant abstinence from heavy drinking. This course is very short, with recovery occurring within 3 to 7 days. Okay? So what are the complications of alcohol abuse? Again, first step is alcohol damages body tissues by irritating them directly. Irritating them directly meaning to say, pumapasok sa tissues natin, then nag-start na yung effect ng alcohol. That later on, it occurs during the alcohol metabolism by interacting with other drugs, which is once metabolize siya sa ating liver, for yung tinatawag natin first pass metabolism, right after that, mag-distribute na siya sa ibang klaseng system ng katawan natin. Then the step 3, of course, aggravating existing disease, accident brought on intoxications, ayun na, ginagawa mo na nga lahat ng mga bagay, which is, ginagawa na yung rape cases, stab, or whatever it is, chaotic factors, just like that. And of course, tissue damage can lead to a host of complications, which is diseases. Okay, ano ba yung other complications? When it comes to our GI complications, chronic diarrhea, esophageal cancer, esophageal varices, gastric ulcer, gastritis, malabsorption, pancreatitis. And when it comes to neuro complications, of course, alcohol dementia, seizures, disorder, peripheral neuropathy, which is delirium, hallucinations, and other psychiatric complications. Again, it is all about suicide, depression, motivational syndrome, at saka yung ating impaired social, of course, occupational functioning. Ito na yung gamot na binibigay sa mga pasyente na sobrang ng dependent when it comes to using substance or addict na, basta ganun. It is used to ensure abstinence in the treatment of alcohol dependence. Its main effect is, of course, to produce a rapid and a violently unpleasant reaction in a person who ingests even a small amount of alcohol while taking disulfiram. Okay, next. So ito yung mga contraindication, dosage, indication, and of course, it depends kung ano ba yung doctor's order natin. So of course, we're going to know kung ano ba yung dapat nating alamin when it comes to this kind of medication. Okay? Next. Ano ba yung action nito? Of course, it inhibits that interferes with metabolism of alcohol that also produces a marked increase in blood acetaldehyde. Hala ka dyan. And of course, accumulation of acetaldehyde, which is more than 10 times what it occurs in a normal metabolism of alcohol. That is also characterized by nausea, throbbing headache, hypotension, sweating first, chest pain, tachycardia, vertigo, blurred vision, associated, of course, with severe anxiety. So ito na yung ibang adverse effect. Fatigue, dermatitis, myocardial infarction, death, cardiovascular collapse, and many more. Again, the nursing responsibility as the nurses, we're going to know all these things with regards to this part, with regards to this particular drugs. Okay, we're going to ensure first that at least 12 hours have elapsed since the last ingestion of alcohol before administering this drug. However, the patient should warn against ingestion of any alcohol-containing preparations such as cough, syrup, sauces, aftershave lotions, or etc. Cautions patient against taking this kind of drug, the depression and other over-the-counter medication during the therapy. You're going to instruct the patient to avoid driving or any other activities requiring alertness. Also, the patient should be warned that the sulfur alcohol reaction may contribute for as long as 2 to 3 weeks, actually 1 to 2 weeks lang after the last dose of the sulfur. Okay, Houdin, thank you.
So next is we have the nicotine abuse disorder. Next po. So nicotine abuse disorder, it is obtained from Nicotiana tabacum. It is one of the most highly addictive and heavily used drug. Next po. And then first it moves to the lungs where it is absorbed into the bloodstream. Also the heart pumps it throughout the body, including the brain, and then nicotine easily moves from the bloodstream into the brain. So how tobacco affects your body? So the brain, nicotine, the drug that makes tobacco addictive, goes to your brain. It makes you feel good when you are smoking, but it can make you anxious, nervous, moody, and depressed after you smoke. Using tobacco also causes headaches and dizziness. For the mouth, tobacco stains your teeth and give you bad breath. You won't be able to taste your favorite foods as well either because it ruins some of your taste buds. Tobacco use also causes bleeding gums or gums disease and cancers of the mouth and throat. For the heart, smoking increases your heart rate and blood pressure. If you try to do these activities like exercise or play sports, your heart has to work harder to keep up. And then for the lungs, smokers have trouble breathing because smoking damages the lungs. If you have asthma, you can have more frequent and more serious attacks. Smoking causes a lot of coughing with phlegm or mucus. Tobacco can also cause emphysema, lung disease, and lung cancer. And then for the skin, smoking cigarettes causes dry yellow skin and wrinkles. The smell sticks to your skin too. And then lastly for the muscles, less blood and oxygen flow to your muscles, which causes them to hurt more when you exercise or play sports. Next po. And then these are the risks from smoking. So cancers, head or neck, the lung, leukemia, stomach, kidney, pancreas, colon, bladder, and cervix. And then this is the chronic diseases, which is the stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease and asthma, reduced fertility, and then hip fracture. So these are the adverse effect of nicotine. So first is the respiratory paralysis, salivation, also the increased blood pressure, the pallor, the abdominal pain and weakness, and then next is the tachycardia and tremor. So these are the other side effects. Next po. So these are the therapies. So first is we have the smoking cessation. to quit smoking lowers the risk of cancer and other serious health problems. Second is the behavior therapy, a range of treatments and technique which are used to change an individual's maladaptive responses to specific situations. And the next is the aversive therapy, designed to cause a patient to reduce or avoid an undesirable behavior pattern by conditioning the person to associate the behavior with an undesirable stimulus. And then hypnosis, involving focused attention, reduced peripheral awareness, and an enhanced capacity to respond to suggestion. And then next we have the violence, abuse, and neglect. So in EDs or emergency departments are often the first place where victims of family violence, abuse, or neglect go to seek help. Next po. Next po. So next is we have the family domestic violence. So it is a broader term that refers to violence between family members, which can include violence between current or former intimate partners, as well as acts of violence between a parent and a child, between siblings, and more. So yung family domestic violence, it commonly happens in every part of the world. So as it stated, yung domestic violence happens inside the family, which can happen between the intimate partners, between a parent and a child, and also between siblings. And also sometimes yung mga victims within the family doesn't realize na nagkakaroon na ng domestic violence within the family because sometimes sinasabihin nila ginagawa lang yung violence because they love them. So minsan hindi na nila alam na yun nga, it is domestic violence. And then it also happens in every community, in all cultures, to young and old, to wealthy and poor, and also in any profession and level of education. Next po. Next is we have the intimate partner violence or IPV. So intimate partner violence, IPV, many times involves violation beyond rape, including physical assault and stalking. So approximately 35% of women and 28% of men have experienced some component of IVP. Next po. And then also IPV involves fear of one partner by another and also control by threats, intimidation, and physical abuse. So next one is we have the abuse. Thank you. Edna.
So next is the abuse. So abuse, it is an action that intentionally causes harm or injuries to another person. So this can refer to physical abuse, psychological abuse, mental abuse or child abuse. So next po. So abuse is when someone hurt causes emotional stress to someone else. So abuse can affect anyone. So it can happen in any kind of relationship like friendship, romantic relationship, or among family members. Abuse can happen in many ways. Hate crimes directed at people because of their races, religion, abilities, gender, or sexual orientation are also abuse. So there are types of abuse. So first is physical abuse. So for the physical abuse, it usually happen when someone hurts another person's body. So physical abuse includes hitting, throwing, or beating the victim. So physical abuse usually leave marks such as bruises or causes pain. For the sexual abuse naman is it includes any type of sexual contact. So it can happen to any ages. So sexual abuse usually done is when the victim is na-feel niya na parang pwede siyang nahipuan or any basta naramdaman niya is that ayan. So next is for the emotional abuse. So emotional abuse happen when yelling and anger go too far or when important adults constantly criticize or talk down to kids that damage the self-esteem of the victim. So emotional online emotional abuse is usually done sa social media. Nangyayari siya sa social media. So it is any type of online message to hurt someone or threaten someone. So online sexual pabalik. Wait lang. Next is nag-crush siya. Online sexual abuse naman is parang sexual abuse din siya pero nagaganap siya online. So online sexual abuse is when someone is asked to share inappropriate pictures of themselves, take part in any sexual activities via webcam or smartphone. Sometimes the people who do this give or promise to give things to get someone to go along with these activities. So the lasting effect of this abuse includes images and videos that can be shared long after the abuse stops. So next po. Okay. So for the effect of abuse, abuse may affect a person's self-esteem, mood, focus, quality of sleep, or interest in activities they once enjoy. The effect of abuse can affect every aspect of a person's life and the effect often lasts after the abuse stops. So, yung effect ng abuse is usually depende dun sa paano i-handle ng victim yung naramdaman niya. So, iba-iba naman kasi yung mga tao paano nila i-handle yung effect nun sa kanila. So, hindi siya masasabi na once na nag-stop na yung abuse is stop na din yung effect nun sa kanila. So, may pwedeng maka-trigger doon. So, the impact of abuse can be different for everyone because a person's response to abuse is based on many things, like their age at the time of the abuse or how much support they have in their life. So, it's important to get help as soon as possible. So, next po. So, next is for the clinical manifestation. So, for the clinical manifestation, when people who have been abused seek treatment, they may present with physical injuries or health problems such as anxiety, insomnia, or gastrointestinal symptoms related to stress. So, for the clinical manifestation, is depend siya dun sa type of abuse na ano nung person. So, for example, for the physical abuse, yung clinical manifestation niya is pwedeng may mga bruises siya or may mga injuries. So, the possibility of abuse should be investigated whenever a person presents with multiple injuries that are in various stages of healing, when injuries are unexplained, and when the explanation does not fit the physical picture. So, next po. So, next is assessment and diagnostic findings. So, nurses must be skilled in interviewing techniques that are likely to elicit accurate information. A careful history is crucial in the screening process since pwedeng traumatic pa yung experience ng patient or ng victim. Kaya medyo mahirap pa yung ginagawa ng mga nurses kapag nag-i-interview sila. Kapag latest lang yung experience ng patient. So, asking question private away from other may be helpful in eliciting information about abuse, maltreatment, and neglect. So, next po. So, assessment and diagnostic finding next is assessment of the patient general appearance and interaction with significant others, an examination of the entire surface of the body, and a mental status examination are crucial. So next. So for the management, if the patient is in danger, he or she should be separated from the person who is abusive or neglectful whenever possible. Referring to a shelter may be the most appropriate action, but many shelters are inaccessible to people with mobility limitation. When abuse or neglect is the result of stress experienced by a caregiver who is no longer able to cope with the burden of caring for an older adult or a person with chronic disease or a disability, respite service may be necessary. Support groups may be helpful to these caregivers when mental illness of the person who is abusive or neglectful is responsible for the situation. Alternative living arrangement may be required. So next. So nurses must be mindful that competent adults are free to accept or refuse that help that is offered to them. Some patients insist on remaining in the home environment where the abuse or neglect is occurring. The wishes of patients who are competent and not cognitively impaired should be respected. However, all possible alternatives, available resources, and safety plans should be explored with the patient. So next.
So, neglect, it is an act of omission or inaction towards someone that can cause some type of harm. Oftentimes, neglect refers to child neglect. A child neglect is when a caregiver doesn't provide necessities or care for the child, even though they have the means to do so. It can be intentional or with disregard for the child's well being. Some don't consider neglect as as severe or impactful as abuse. Maybe a single act of neglect isn't child abuse, but repeated neglect is. Neglect can leave long term damage just as much as abuse and really, neglect is a form of abuse. So, these are the types of neglect. We have here the physical neglect. A physical neglect is usually what people think of when they hear the word neglect. It occurs when a child's basic physical needs repeatedly go unmet. So, one of the example is that the failure to provide adequate food, water, clothing, supervision, and healthcare, and failing to provide for the child's safety. Usually, ito ang physical neglect. Makikita natin to sa family na masyado nang madami. Silang magkakapatid, like 5 or 6 and above. Sa sobrang dami nila, hindi na kayang i-accommodate ng parents yung ibang needs ng mga bata. Sometimes, they are asking other children na parang mag-sacrifice for the other siblings that they have. And then next is medical neglect. A medical neglect is a form of neglect wherein a failure to provide proper health care for a child even when financially able to do so. So examples are failure to seek necessary medical, dental, or psychiatric care for the child because sometimes there are parents na parang mas naniniwala sila sa home remedies na lang. Kaya they neglect their child's medical needs, and then failure to comply with medical treatment for the child, withholding medical care with the intent to cause harm or even death. And then next is the educational neglect. It occurs when the child isn't given access to education or when the child is excessively absent from school. So the examples are failing to give child an access to education, allowing excessive absences from school, then failing to allow remedial or special education services. And then we also have supervisory neglect, wherein supervisory neglect, it's when the adult responsible for the child fails to supervise or provide proper supervision to keep the child from harm. Examples are repeatedly leaving the child in the custody of others for days or weeks at a time, iniiwan sa lola, sa kaibigan, sa pinsan, ganyan. Then, failing to supervise a child around weapons or other dangerous circumstances. Then, leaving the child with an unfit or impaired caregiver. then abandoning the child without arranging for reasonable care for supervision. Another type of neglect is the environmental neglect. Environmental neglect, these are the exposure of the child to the hazards and unsanitary conditions in the home. And then lastly, we have emotional neglect. This occurs when child's emotional needs aren't being met. It is when the caregiver is not giving the child the love, care, affection, and attention, and the child needs to healthily develop. Emotional neglect are actually common with Filipinos kasi parang there's always this or there's always a boundary between a parent and a child where in fact dapat mas intimate yung relationship kapag family. Um, Examples are persistent indifference to the child's need for attention, affection, or emotional support, allowing abuse or violence to happen to the child without intervening, rejecting, ignoring, excluding, isolating, mocking, teasing, humiliating, terrorizing, or intimidating the child. And then we'll proceed with the psychiatric emergency. Emergency is defined as an unforeseen combination of circumstances which calls for an immediate action. A medical emergency is defined as a medical condition which endangers life and or causes great suffering to the individual. Then the psychiatric emergency, this is a condition wherein the patient has disturbances of thought, affect, and psychomotor activity leading to the threat to his existence or suicide or threat to the people and the environment. Conditions in which there is alterations in behavior, emotion, or thought presenting in acute form in need of immediate attention and care. So the characteristics are any condition making the patient and relatives to seek immediate treatment, disharmony between subject and environment, sudden disorganization in personality which affect the social occupational functioning. Now, the objectives for emergency intervention is to safeguard the life of patient, to bring down the anxiety of family members, to enhance emotional security of others and the environment. And then we also do have the types of psychiatric emergencies. So first one is we have suicide or deliberate self-harm, and then violence or excitement. We have stupor, panic, withdrawal symptoms of drug dependence, alcohol or drug overdose, delirium, epilepsy or status epileptics, and severe depression, suicidal or homicidal tendencies, agitation, or stupor. Next po.
Jose.
So, good morning, everyone. I'm the one who will report the suicide. So, for suicide, we have the deliberate self-harm. What is suicide? One of the common psychiatric emergency, common cause of death among psychiatric patients. Suicide is defined as intentional taking one life in a cultural, non-endorsed manner. Attempted suicide is an unsuccessful suicide act with a non-fatal outcome. So we have here is the etiology, we have the psychiatric disorder, we have the major depression, schizophrenia, drug or alcohol abuse, dementia, delirium, and personality disorder. So for the second, we have the physical disorder. We have the chronic and incurable physical disorder like cancer or AIDS. So for the number three, we have the psychomotor factors. We have the failure in examination, dowry harassment, marital problems, and loss of loved objects. So this is the warning signs of suicide: appearing depressed or sad most of the time, withdrawing from family and friends, making overstatement like "I can't take it anymore," "I wish I were dead," losing interest in most activities, being preoccupied with death or dying. So we have here the management. Be aware of the warning signs or monitor the patient needs. Like take all suicide threats or attempts seriously. Do not leave the drug tray within reach of the patient. Make sure that daily medication is swallowed. Remove sharp instrument from the environment. Patients should never be left alone. And we have the acute psychiatric emergency interview, counseling and guidance, treatment of psychiatric disorder. So, ayun nga po, yun sa management. Parang sinasabi is, kailangan nating bantayan or i-monitor yung patient para po hindi po siya maburyo or hindi po siya mag-attempt ng suicide at hindi po siya mapag-isa. So, we have here the different types of violence, excitement, aggressive behavior. And for the violence, we have the physical aggression by one person to another person. During this stage, patient will irrational and operative delusion and assaultive. Next. So this is the etiology. We have the organic psychiatric disorder like delirium, dementia, Wernicke-Korsakoff psychosis, and this is the other psychiatric disorder, schizophrenia, mania, agitated depression, withdrawal from alcohol and drugs, epilepsy, acute stress reaction, panic disorder, and personality disorder. So these are the do's and don'ts for the suicide. For the do's, protect yourself, unharm the patient, keep the doors open, keep others near you, do restraint if necessary, assertive authority, show concern and establish rapport and assure the patient na parang safe siya sa'yo. And this is the do not keep potential weapon near to the patient. Do not sit with back to patient. Do not wear necktie or jewelry. Do not keep any proactive family member in the room. And do not confront the patient. So this is the management for the suicide. We have the untie the patient if tied up. Reassurance, talk to the patient softly. Firm and kind approach is essential. Ask direct and concise question. Avoid yes or no question. Assist the patient in defining the problem. And this is the sanitation. We have the diazepam, 5 to 10 mg, slow intravenous. We have the haloperidol, 2 to 10 mg. We have the intramuscular and intravenous. For the chlorpromazine, we have the 50 to 100 milligram. We have the IMO, intramuscular. So for the management, collect the detail, checks, and explore the cause. Carry out the complete physical examination. Keep environment stimuli to the minimum. Stay with the patient to reduce anxiety. Encourage patient to talk out the aggressive feelings rather than acting them out. So this is the stupor and catatin syndrome. Stupor is a clinical syndrome of akinesis and mutism, but with relative preservation of conscious awareness, often associated with catatonic signs and symptoms. Catatonic syndrome, any disorder which presents at least 2 catatonic signs. We have the catatonia, either excited or withdrawn, and catatonic. Signs negativism, mutism, stupor, ambitendency, ecolalia, ecopraxia, catalepsis, and stereotypes. So this is the another measures for the stop-proof patient. Ensure the patient airway, maintain hydration, check vital signs, and history and the physical examination of the patients. identify the specific cause and threat, care of skin, nutrition, elimination of personal hygiene is required, give ventilatory support if needed po. So for the next, we have the panic attack. Episodes of acute anxiety and panic occurs as a part of psychotic and neurotic illness. Manifestation, palpitation, sweating, tremors, feelings of choking, chest pain, nausea, abdominal stress, and paresthesia. So this is the management. Give a reassurance on the patient, search for causes, consult the patient and relatives, use behavior modification and techniques. Victims of disaster. People who have survived sudden, unexpected, and overwhelming stress. Features like anger, frustration, guilt, numbness, confusion, flashbacks, depression. So this is the management for the treatment of the threatening physical problem. In this intervention, listen attentively, do not interrupt, acknowledge and acknowledge and understanding of the pain and distress, console them from patting of the shoulder, touching, holding their hands. Do not ask them to stop crying. Provide accurate and responsible information. And we have the group therapy and benzodiazepines to reduce anxiety as prescribed by the physician. That's all for. Thank you.
So that would be all. Thank you very much.
Okay na yata. Wait lang, tanong ko. Sa'yo, gago. Okay na.